And you know, the NDIS was meant to transform people's lives. I spoke with people before the scheme was in place about their expectations for it. Greta was a fantastic advocate for it. She has cerebral palsy, she's in a wheelchair, and she was one of those who could see that as a young woman it could provide a pathway to independence for her. And indeed it has. And I was just messaging her today, actually, having seen that she has had her COVID vaccination, and speaking to her about what she's finding. And of course what we do know is that only around about 26% of participants on the NDIS are vaccinated. And that, you know, this is a group of people among the most vulnerable who were in the first two phases, in 1B of the rollout. They may have even been in 1A, but they're right at the start of the rollout. Yet we have an appallingly low COVID vaccination rate for them. Not only that, but many of them are finding that their carers have not been able to access vaccines. And one said to me, all the carers have registered on the government's website months ago, but haven't received any information, Deputy Speaker, about how they actually get a vaccine. And now, what it all says to me is, you know, we see this legislation that's meant to improve people's lives. However, what in reality happens is that so many of them are left behind. And I think that the biggest concern for people who rely on the NDIS is that promises are made, but promises are not necessarily kept. I just want to take people back to the months of anxiety that was created around independent assessments, when people were told that things would be totally changed, that all the medical stuff that had happened would actually be thrown out the window and independent assessments would come in. Now, it was advocacy from the sector, advocacy from people like me, advocacy from the participants themselves that meant that we're not currently having a discussion about that, because that was going to completely turn around what people's expectations and their hopes were for the scheme. But it wasn't just done in a consultative way. It was done without any consultation with the sector. It progressed without any consultation with the sector. And for goodness sake, the very people who have to fight for absolutely everything, for every improvement that they've had in their lives, for every bit of support that they get, they were then made to fight yet again by this government, to fight for something that should never, ever have been put forward in the first place. And I think for me, I saw people broken by that. People who had been resilient and advocated and were happy to work through the challenges of a scheme. But that's what really broke them and pushed them to an edge. So I think when we look at the way this government has treated people with disabilities and the people who care for them, and when I say the people who care for them, I mean their families as well. I can only say that right now I know a mum who's partway through a couple of weeks of lockdown with a daughter who has autism because of being a close contact for COVID. And she has had tears. There's been lots of tantrums from mum and her daughter, and the sort of process that people are being asked to do, I don't think any of us have any understanding of what that must be like, and there's very little additional support for people. So you know, we were very clear that we needed to see changes made. What is coming through my office right now is that decision-making processes for the NDIS have slowed right down. that they've slowed yet again to a crawl, and people who are waiting for a decision, waiting for an appeal, waiting just to get information about where something is at, are finding that it has got really, really slow. What people tell me, of course, lockdown has taken away all our choices. But that is even more profound for people whose lives had some richness in them because they could go out to programs, but all that has been taken away. So their choices have been taken away. There are going to be people who possibly find it hard to get back to what they had. Because once you lose that social contact and the things that were built up over a period of time, and then the doors just slam shut on it. And obviously having high levels of vaccination would really make a difference. But I also want to talk about what I'm seeing with another constituent who's facing in New South Wales the challenge of rapid antigen testing. Now, this is a disability provider, and what's happening in New South Wales is if you're not in an area of concern, not in a local government area of concern, and the Blue Mountains and Hawkesbury is not a local government area of concern, we're in lockdown, but not the tightest lockdown, not with curfews at night, not with security guards roaming around, not with intense vaccination hubs happening either, for that matter. Heaven forbid we should try and get ahead of the curve. So we are in a limbo. We're seeing cases rising, and one of the reasons they're rising is because workers from local government areas of concern do come into our electorate to work. So people have been employers, and this is where disability care fits in. Employees from local government areas of concern who have not been able to be vaccinated are required to have rapid antigen testing. Well, that's just been announced. It all comes into effect really fast, and the providers are saying to me, we can't even work out how to do this. It's not legal to do it without a healthcare professional there. So how do we get a healthcare professional to every one of our group homes to try and do this? So the practicalities and logistics of these announcements are going to create even more problems and challenges for disability care. Deputy Speaker, one of the things that this legislation looks at is those for whom their whole care is trusted to the NDIA. The NDIA is the one who oversees the quality of the care that they get, has overseen it. And we have seen catastrophic failures because of the structure that was put in place. So we absolutely need to see these improvements come forward. We need to make sure that what happened in South Australia isn't repeated. But what we also need to see is more broadly that quality of care is not just regulated, but that we are training people up appropriately to provide the quality of care that is needed. Every time I look at this government's policies to fix things, the bit that's always missing is the workers. The bit that's missing is the skilling up of the workers, the supporting their ongoing education so that they are building their skills and expanding their skills. So we're constantly improving the quality of care that people have and people receive and people deserve to have. The quality of care becomes a challenge when you haven't got enough carers. So building up the volume of carers is really key, but then continuing to allow them to progress so that they actually have a career path there. And I really, really thank the Australian Services Union for the work that they have been doing over many years to look at how we do this. I want to come back, Deputy Speaker, to vaccination rates for and the vaccination process for people with disabilities, but also for their carers. In the Blue Mountains and the Hawkesbury, it's an area of 4,000 square kilometres. Not as big as some electorates, many electorates, but for a city electorate, it's pretty big. Yet there's been decisions to date made that require people in my electorate of the Blue Mountains and the Hawkesbury to either access their vaccination at their GP, or now, if they're able to have AstraZeneca, at the pharmacy, although we're still seeing slow supplies. My GPs tell me that sometimes the Pfizer supplies that they've been promised and they've taken booking for simply don't turn up. A whole week's supply just doesn't turn up. And, you know, this is the moment where I really want to do a shout out, yes, to the GPs for the work that they're doing, and to the practice managers and the work they're doing, but to the receptionists, the people who are taking the phone calls in GPs' offices and clinics. They must be the heroes, because they're the ones. I know we get desperate emails and desperate phone calls, but they would be absolutely smashed with phone calls from people saying, this is my situation. I have a disability, or I have a daughter with a disability, or I have a carer coming in. All those sorts of circumstances which we all know those people ought to have been vaccinated by now under the rollout plan. I love plans, but I like them much better when they're actually delivered, not just some future promise. And these have been unfulfilled promises to people, unfulfilled commitments that they would be not just able to be vaccinated, but it wouldn't be the onerous process that it is. I don't know if anyone in this place has actually tried to book a vaccine, particularly if you're in the Blue Mountains and the Hawkesbury, and there is not a hub to do it at. So you phone every single GP that you can, along with lots of other people phoning them, just to see, can I go on a waiting list? Here's my circumstance, can I do it? Or you jump online. And the online process just takes you in circular motions back because there's nothing available to book yet. So these are the challenges people are facing. And for people who are for whom life has certain challenges already with a disability, we actually should be making it easy. For the Blue Mountains and Hawkesbury, we should be taking the services into those areas. We should be travelling to the furthest places within those communities. Now, people say, oh, you've got quite good vaccination rates. Yes, we do. But the harder people to vaccinate are those who haven't had it done yet, and they are in more remote or transport-challenged areas. There is no public transport in most of the Hawkesbury. If you're not on the train line, which has, I think we've got 5 stops in my electorate, takes you to Blacktown, doesn't even take you to Penrith, which will ultimately be our nearest hub. It takes you into the hotspots if you want to do it by public transport, or into a hotspot if you want to drive there. We have to go into the hotspots in order to find a mass vaccination hub, which is where people are being steered to. They're being told, yep, if you can't get into a GP, go for the hub. But there just isn't one near enough. And what it really misses is the idea that we could take these mobile teams and reach into these communities. And in fact, you could probably get quite a wide penetration of that community with the vaccine if you went there, because it's easy. Your neighbours are doing it. You can take anyone in your family along with you to do it, and it would really make a difference. So it's time for this government to think about creative approaches. We haven't had the vaccine supply. That has been our #1 problem. Yes, if we hadn't had leakages from quarantine, it wouldn't have been such a race. But we didn't have quarantine that really held. We all know that. We still don't have it. We've just got plans for it. We still have leaky quarantine. We still don't have enough supply. But even when we do have enough supply, we do not have the plans to take it into the community, particularly into places where you'll be able to do large numbers of people with disabilities. We need to do for them what we did with aged care. But the difference is we need to do the carers as well. And that's the only way that people with disability will be really looked after.